Hi, in this video, I'll be talking about what you should bring to your appointment for your breast surgery. First of all, it's important for you to ask whether you'll be staying overnight in the hospital, and if so, for how many days. Many people have surgery done in an outpatient center and are expected to go home. So the things you should bring are going to differ based on whether you have an overnight stay or you're there for a few days. For example, if you have breast reconstruction using your own tissue, you will be in the hospital for longer than if you have breast conserving surgery with a lymph node, sentinel lymph node, or lymph node dissection. So you don't want to take too much if you're not going to need it. I'm going to talk about a few things you should bring if you're going to be staying overnight in the hospital for one or more nights. And you will find that people will agree or disagree with this, but here are some hints that can make it really helpful. First of all, we'll start with the top going down. So if you have long hair or hair that can be put in a ponytail, you may want to bring a hairband. It's just nice to have your hair out of your face. Your hair will be covered during surgery to keep the whole operating room sterile, but you may want some help to just keep your hair out of your face when you're eating or out of your the surgical wound area when you're getting wound care. Then we'll go down. You might want to bring eye drops. Hospitals can be really dry and over air conditioned. So if you tend towards having dry eyes, bring some eye drops. You might want to bring some lozenges, and the flavor is up to you. You can bring mint. Butterscotch can be really nice. And citrus can be good, hard candies. The reason I bring that up is because when your IV is flushed with saline, some people can actually taste the preservative and the saline itself, and it's really unpleasant. So you may find that just popping in something like a hard candy ahead of time can be helpful. We'll stick with the mouth area. Hospitals have their own toothbrushes, but the quality is not like the quality of the toothbrush you have at home. So bring in a toothbrush that you like. Don't bring in alcohol-containing mouthwash. You can bring in another kind of mouthwash if you want. There is toothpaste provided in the hospital. The next thing to think about is you might be chilly. So you may want to bring in something that can help you feel cozy, whether that's a scarf or a nice sweater or a hoodie with a zipper. You want something that opens to the front, something where you don't have to raise your arms up, because if you've had surgery under the arm, that could be a little hard the first couple of days. So we recommend bringing something that zips up from the front, and that can add an extra layer of warmth. Don't expect that you'll have to be in a hospital gown. You can wear your own clothes in most hospital settings. So you'll want to bring comfy underwear and usually not a bra right away. But if you do bring a bra, if your team says you should bring one, try to bring one that opens and closes in the front and that's soft and cottony, no underwire. Not that you can't wear underwire, just when you're in the hospital, you may actually want to sleep with your bra, and underwires can be really uncomfortable. This is if you wear a bra. Obviously, if you don't need to worry about it. And then let's see what else. For your underarms, you may want to bring some deodorant wipes. After you've had surgery in the armpit area, we try to have you avoid using any antiperspirant or deodorant on that side. But you'll want something for the other side just so you feel fresh, even if you're not taking a shower. If you have a drain in place, that will drain into usually a little plastic bulb, and a fanny pack can be really helpful for holding that. When you are in the hospital, they'll pin it to your clothes or to your gown, but when you go home, you may not want to pin it. You may want to actually carry it at your waist level, depending how long the drain is. If it's really short, let's go with the pinning option. If it's really long, a fanny pack can be helpful, or something you can wear over, like a crossbody bag can be helpful, or a crossbody fanny pack sort of thing. Bring warm socks. You'll be given those little footies in the hospital that have the little sticky pads. Not a bad idea. That keeps you from slipping. But if you have a pair of favorite socks, you can bring that in. I always recommend you have something to write with and something to write on. You want to write down the names of the people you're seeing. So if you get information from a nurse or a doctor, write down their name, because then when you're talking with other doctors, you'll want to say, Dr. Jones said this. Is that, how long do I need to do that? Or my nurse so-and-so said in the morning shift that I'll go home with pain medicine. When do I get those medications? Does that make sense? I hope it does. If it doesn't, drop a comment or question below. And if you want to learn more about your specific treatment options you might hear about, go to yerbba.com for your personalized report. Couple other things. If you have something that makes you feel more at home, bring that, like a little throw for your bed. You might want to think about earplugs or an eye mask if you have a hard time sleeping. If you do have a hard time sleeping, don't be afraid to ask for something to help you fall asleep the night of your surgery. I recommend that you not have people send you flowers or balloons, because all that stuff has to go back into the car when you leave. And it's very nice for people to do that, but it does add an extra layer of complication to something that's already pretty tough. You won't avoid all the flowers, I hope, that people are caring for you. You want to bring something that you like to snack on. Hospital food is notoriously not delicious, and it can be strange. So if there's a favorite snack that you have, crackers or something you like to munch on, carrot sticks, you can bring those yourself. Don't bring your own medications from home. They can't give those to you. If you're on something very unusual, that you can bring that in, that'll be sent to the pharmacy to confirm that's what it is, and then you can take your own medicine. One thing I do want to tell you is that if you ask for a bag of ice or you're given something like that, you will be charged for that. And that's something that can be very surprising to people. If you have insurance, it is covered by insurance in most cases. But I just want to prepare you that things like a nonsteroidal anti-inflammatory drug like ibuprofen, the brand name is Advil or Motrin, you're going to get charged for that. So you might think, I can circumvent that by bringing in my own medication. But again, it's pretty tricky to do that. I just don't want you to be surprised, like many of us are when we actually take a look at our bill a couple months later. If you are not staying overnight, bring as little as you can with you. Bringing something to keep you warm is helpful, and some socks, and something to write with, and something to write on. Those are the key things that you really need. You'll want to bring your cell phone, of course, so you can contact your friends and let them know how everything is going, but pretty much keep it to the bare minimum. That's what I recommend, just because the less complicated your life can be right now, the better. I hope this has been helpful. If you have found things helpful to you that you want to share with our viewers, drop it in the comments below. Everybody has their own experience, and it's really nice to share with each other. We really have a nice Yerbba community. By clicking subscribe and like, what that does is it helps other people who are interested in the same things find this video. And we're wishing you all the best as you get ready for and get through the surgical period.